Removable partial denture. Partial dentures are designed to restore missing teeth and to preserve the remaining hard and soft tissues of the arches. The partial distributes the forces of mastication between the abutment teeth and the alveolar mucosa. The abutment is a natural tooth that becomes part of the support for the partial. The abutment teeth must be in good condition or be restored to withstand the stresses of chewing with a partial denture. Advantages of a removable partial denture. Reasons that a partial denture may be part of a patient's treatment plan when he or she has missing teeth are as follows. Partial dentures are repaired and adjusted easily. If teeth are lost in the dental arch, they can be added to the partial denture. When there are no teeth for a distal attachment, the removable partial denture is one treatment choice to restore function to that quadrant. Partial dentures require fewer intraoral procedures than fixed prostheses. This means fewer appointments and less chair time for the patient. Maintaining good oral hygiene of the abutments and the appliance is easier for the patient because the prosthesis is removable. The partial restores the mesial distal contacts between the teeth and the anterior-posterior continuity of the arch. This provides support that teeth standing alone do not have. Therefore, the arch is stabilized. The partial maintains a proper occlusal plane by preventing supereruption of the teeth on the opposing arch. The removable partial makes it unnecessary to reduce tooth structure. The partial appliance can be fitted to children and adolescents and is replaced easily to compensate for a child's growth. When several teeth are missing in both quadrants of an arch, a removable partial denture is designed to restore lost dentition in the both quadrants. The missing teeth of both quadrants are then connected in one long-span appliance. Removable prostheses may be designed to support periodontally involved teeth. Compared to a fixed prosthesis, the partial prosthesis is a less expensive treatment. Considerations for a partial denture. Before choosing the partial denture as the treatment, the dentist must consider several factors. There must be a number of sufficiently positioned teeth in the arch to support and stabilize a removable prosthesis. To retain the appliance, there must be adequate root structure of the remaining teeth, and the alveolar bone and mucosa must be evaluated to determine whether they can support the partial denture. Another consideration is whether the patient exhibits interest in and is motivated to adjust to the partial denture. The patient must also maintain good oral hygiene, especially around the teeth to which the partial is attached. Components of a removable partial denture. Components of the removable partial denture include the metal framework, rest, connectors, retainer, denture base, and artificial teeth, figure 36-3. Partial dentures are designed for individual patients without set patterns. This means the number of teeth involved, their position, and shade, color, may all be different, and the partial is designed according to the patient's needs. Metal framework. The metal framework is the skeleton of the removable partial, figure 36-4a, to which the remaining units, such as the rests, connectors, and retainers, are attached. Part of the framework is a mesh or loop area designed to retain the acrylic base material. The acrylic portion of the partial denture surrounds the framework. Rests. The rests are the part of the removable partial denture that contact a tooth to provide vertical and horizontal support. The rests control the position of the partial in relationship to the supporting structures. To provide the best support, the rests are placed as close as possible to the center of the tooth so that they can direct functional forces to the long axis of the tooth. These rests are positioned on the occlusal, incisal, or cingulum, lingual, surfaces, figures 36-4b and c. Connectors. A connector unites the various parts of the partial into a single unit, hold the working parts in the proper position, and distribute the stresses. They are divided into major and minor connectors. The major connectors connect the left and right quadrants of the partial. On the mandibular, the major connector is often a lingual bar or plate. On the maxillary, the major connector is a palatal bar or strap or a complete palatal plate, figure 36-5. A stress breaker, or hinge, may be built into the partial. This is a metal device that relieves pressure on the abutment teeth. The stress breaker is like a hinge that gives some release to the occlusal stresses during mastication. The minor connectors connect the major connectors with the other units of the partial, such as the clasps and rests. They maintain the integrity of the arch by an anterior-posterior bracing action. The minor connectors protect against food impaction by filling the tooth tissue junctions. Retainer. Sometimes called a clasp. The retainer contacts the abutment teeth and prevents the partial from moving. The position of the prosthesis is controlled by the retainer and its relationship to the remaining teeth and support structures. Retainer designs are usually circumferential or bar type. The circumferential type clasp, retainer, encircles and adapts to the contours of the abutment tooth, figure 36-6. The bar type clasp extends from a gingival direction toward the occlusal. Partials can be designed with no facial clasp showing, and are made in several variations that will fit most patients. These partials are strong, have good retention, and reliably stay in place. The aesthetic factor makes them appealing to most patients. The clasps are designed to fit on the lingual, wrapping interproximally without showing on the facial. In some designs the metal also extends onto the occlusal, figure 36-7. Denture base. The denture base is most often made of acrylic resin with fibers to provide a natural appearance. It rests on the oral mucosa, providing coverage and stability. This portion of the partial is sometimes referred to as the saddle. The denture teeth are held in the denture base. A flexible denture base resin is available that can be used for partial dentures. This material feels more natural and comfortable in the mouth because it is lightweight and thin. The resin is available in basic shade categories of medium pink, light pink, and ethnic. This partial is an aesthetic choice, and is suggested by some dentists for their patients. The technique for the flexible resin-based partial is very similar to the regular hard resin material, except that the flexible partial is immersed in very hot tap water before insertion in the patient's mouth. After about a minute, the partial is removed from the water and allowed to cool until it can be tolerated by the patient. The partial then adapts well with the natural tissues in the mouth. If adjustments need to be made, a green-mounted stone is suggested, followed by using a brown rubber wheel to smooth rough surfaces, figure 36-8. Artificial teeth. The artificial teeth are made of acrylic resin or porcelain, and are available in a variety of shapes, molds, sizes, and shades. The artificial teeth are secured to the denture base by pins or holes on the undersides of the teeth. See denture teeth under the components of a complete denture section in this chapter. Partial denture procedure. The abutment teeth where the metal framework of the partial rests must be prepared before the final impressions are taken. The occlusal surfaces of the teeth are reduced to allow for clearance of the metal framework of the partial between the arches. This surface must be contoured so that the partial denture will be held firmly in place. The buccal and lingual surfaces are prepared to allow the partial to be inserted and removed without binding. If the teeth cannot be contoured adequately with burrs, discs, and stones, they are prepared for fixed crowns before the partial denture is fabricated. After the abutment teeth have been prepared, the dentist takes final impressions and a bite registration, procedure 36-1. These are sent to the dental laboratory with a laboratory prescription form. The dental laboratory follows the dentist's instructions and constructs an appliance that consists of the cast framework and denture teeth set in the wax bite rim, figures 36-9a, b, c. The partial denture is articulated on the models to simulate how the appliance will occlude and mesh in various jaw positions. The laboratory then sends the partial to the dental office for the try-in and any adjustments, procedure 36-2. The delivery appointment is outlined in procedure 36-3. See table 36-1 for the appointments for a partial denture.